The next question we're going to ask ourselves is, could this be another serious illness that's presenting with a rash? And the reason I've used a vague topic like another serious illness is just because there's a couple of things that might present to the emergency department in your paediatric area, but are rare enough that most emergency doctors won't be familiar with them. Many won't have seen them before, and you probably won't have this at the front of your mind if you've never seen it before. So it's going to be difficult to remember this stuff, and I'm not going to go through an exhaustive list of pathology and etiologies for things that you may never see or certainly won't have seen before when you're seeing them for the first time. So this is just a catch-all term. We're going to just run through a couple of key features of things that would make you think, okay, I don't know what this is, but I know it's bad and I need to do something about it. So the first one is this pairing of Stevens-Johnson syndrome and toxic epidermal necrolysis. And these two conditions were thought to be separate, but now they're characterised more of a spectrum from one end to the other. So you can see that the rashes look really nasty. They're kind of angry looking. You've got desquamation. You've got involvement of the mucosal surfaces in the mouth or elsewhere. And you might have significant skin loss. So at the severe end of the spectrum, you can get greater than 10% of the total body skin lost, which is a really unpleasant thing for the patient. And then we've got another condition that I'll just touch on called Staphylococcal scalded skin syndrome. So again, you can see this is a really nasty looking red, angry rash. It's a miserable child. They're unwell. This is not someone who's probably eating and drinking and playing and running around. This is a sick kid. They've got abnormal observations. They're not behaving well and they're having a terrible time of it. So you could talk for ages about the pathophysiology of these conditions, how they're managed, what the differences are, how to distinguish them, how to diagnose them. But you're not going to remember all of that because you hardly ever see them. But the common features that I want you to think of are, firstly, the patient is unwell. So like I said, they're not a happy child, they're actually sick. And any child who's sick, whether or not they've got a rash, that's got to prompt some serious consideration for escalation, urgent treatment. Maybe they need urgent antibiotics. Maybe they need an admission and IV access and bloods. But they need some escalation. And secondly, the rash looks really bad, looks really dramatic. These bright, angry rashes that cover a lot of the body. You might get desquamation. It's unpleasant looking. And it's going to be difficult to remember the exact features of those rashes. Where do they occur? What exactly are the histopathologies and stuff? But you don't need to. You just need to know if you see a rash that looks really dramatic like that and where they're losing a lot of skin, you need to take that seriously and escalate it to a paediatric specialist pretty quick. So that's what I really want you to remember. You could talk for an hour on each of these topics, but it's not going to be helpful for you if I do that because it's just not something that you're going to see often enough to make that worthwhile for you. But just remember, if you see an unwell child with a rash or you see a really, really nasty looking rash, you need to escalate it because they need some urgent management. So take-home points are, get help early, and even if you can't remember the exact diagnosis, recognise that this is still a serious condition.